The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit ViconSupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Hello, everybody. Welcome to another episode of the Human Optimization Podcast. As you may know, I'm Lisa Pitel-Killah, your host, and I am here today to introduce to you Dr. Ben Thompson. Let me tell you a little bit about Ben. He's a licensed audiologist and the founder of Treble Health, a nationwide private practice specializing in tinnitus and hearing loss. After completing his residency at UCSF Medical Center, Dr. Ben became one of the first to blend evidence-based audiology with digital care, and we're going to dive into that today, providing personalized sound therapy and cognitive strategies to thousands of patients remotely. He trained under Dr. Paul Jastroboff, creator of tinnitus retraining therapy, otherwise known as TRT, and his team has helped over 5,000 patients find relief. Through his YouTube channel, where he has over 150,000 followers and subscribers, and podcast Tinnitus Relief, he makes expert care accessible to millions silently struggling with chronic ear ringing. Dr. Ben, welcome to the show.
Thanks so much for having me.
I'm excited about our talk, and I always love to bring to the table the background of how did Dr. Ben get here doing what you're doing today? Tell us the story.
Well, I was able to study with amazing mentors in this field and decided to specialize in tinnitus, or what also is pronounced tinnitus. Most doctors will say tinnitus. Most lay people will say tinnitus. So I'll say tinnitus for this talk, but both are completely okay. And I specialize in this field because this is a condition where people go to their doctor and oftentimes they're told there's not much you can do about this. Sorry, you just have to live with it.
Right.
There's no cure. I don't know. I don't have anything to help you. That's not only the ear field that experiences that. There's many conditions that experience that, GI, gut issues, certain brain issues, child development. So if tinnitus, ringing or hissing in the ears or the head, that falls into this category of it's a hard problem to fix. Most doctors don't have an easy solution to it.
Right.
I was able to study under some great mentors in San Francisco and then in Maryland as well. And they showed me the protocol to follow to get patients better. So patients can go from being told there's nothing you can do, you just have to live with it, to, wow, this is significantly better. And I feel like I have my life back. So my personal story is really all centered around that. Started a YouTube channel, started a telehealth business, and I run that practice with my brother, who's also an audiologist. And it's focused on hearing health. So ears, tinnitus, hearing loss, and all the other impacts that it can make on someone. So tinnitus can affect someone's sleep. It can create anxiety and stress. Hearing loss is being linked to a risk factor for dementia and cognitive decline. So overall, we're impacting the nervous system, our brain, and our hearing, it turns out, can really reach farther than the ears into the whole body.
Of course. Well, everything is connected, as we well know, right? So that's not surprising. I feel like you kind of answered this already, but so many people feel like there's no solution, but you have a solution.
Yeah, this is a condition where there are ways to reduce it, there are ways to manage it. It's a very individualized approach.
Mm.
There's 5 significant root causes of tinnitus, and a
Mm-hmm.
colleague of mine, an ENT physician, found that in his practice, 80% of cases had one of 3 root causes. So it's a complex condition, but it can be simplified, and hopefully I can do that today here to your audience. Um,
Mm-hmm.
but when there's multiple root causes going on and there's not an easy solution, it becomes a condition that's really hard to manage by oneself. I think
Mm-hmm.
of me trying to um, make my sleep apnea better, and that was pretty straightforward. That wasn't that complex, but even still, I needed help, and there's still some conflicting approaches or different theories or ways to handle it. I think tinnitus is more complex. There's many different approaches or opinions on it,
Mm-hmm.
especially searching on
Yeah.
the internet. It seems like a chiropractor will look at it of how can we adjust the spine. A nutrition person will say, "Oh, it's your insulin or your blood," and an ENT surgeon will say, "I can't do a surgery. I have nothing for you." Um, what we've tried to do as tinnitus specialists, really, it's all we do,
Mm-hmm.
is
Yep.
that we focus on the 2 main pillars of what gets people better, which tend to be a sound-based component, an auditory
Mm-hmm.
component, and also a cognitive-based component, or more on the psychology tools to affect the brain and the nervous system. So that tends to be the right approach for most people, but is very personalized.
Yeah. Oh, absolutely. And what about stress and anxiety?
Huge. Tinnitus can cause stress and anxiety.
Mm-hmm.
It's very common. That
Yep.
What do we know? I'd be curious to hear from your perspective of hosting your
Mm-hmm.
podcast. What are the downstream negative effects of anxiety and stress? I mean, there's so many, I believe. So
Yep.
I'm curious to hear your thoughts on that. But tinnitus can create those symptoms or
Mm-hmm.
conditions, but also having anxiety or chronic stress can create or cause tinnitus in some cases. What have you found in terms
Yep.
of how humans are, dealing with anxiety and stress these days?
Well, and I think anxiety these days is running rampant, right? It's probably one of the most common that we come across, and it's stress related as well. So I always think of everything. My mind first goes to a mineral perspective, right? So as soon as we have a stressor and the mineral patterns change, anxiety is driven by potassium deficiency, magnesium deficiency, zinc deficiency, right? So these things change over time. The more stress becomes chronic, and it's interesting because there are a lot of individuals that end up having ringing in the ears and other symptoms. And again, there tends to be 2 different avenues that you've already mentioned, whereas the stress can cause it, the condition, but the condition can actually contribute to the stress.
Absolutely. And
Yeah.
that's a vicious circle for people who are struggling with
Yeah.
this. And some of us listening here might know someone with tinnitus, or we might not. But it's one of these conditions that can create the heightened nervous system, can create stress, anxiety, less breathing, shallow breathing, tightness in the
Hmm.
shoulders, and uh, poor sleep, ruminating thoughts. The actual sound of tinnitus makes it hard to sleep. Of course, it's the quietest
Yep.
part of your day is when you're trying to go to sleep, typically.
Yep.
So therefore, this is just a vicious circle, a vicious cycle for some individuals where tinnitus leads to stress, stress leads to bad sleep. Both of those can lead to louder or more intrusive tinnitus.
Mm.
So yeah, that's the work that we do, is helping people with their nervous system and with their ears.
Yeah, that's amazing. Well, my dad struggled with it. It wasn't constant, but it was definitely there. So that's one of the things that he had a challenge with in his elderly age. So I'm very familiar with it for sure.
Do you know what was the cause of his tinnitus, or if he had hearing loss, or did he
Do
wear
you?
hearing aids?
He didn't actually. He didn't wear hearing aids. I have a question for you. I'm curious. Do you think that there is the potential of toxin overload contributing to the stress that then could contribute to tinnitus?
It's certainly possible. There's certainly, I'm not a specialist in toxins, so I really can't comment,
Yep.
but
Yep.
stress on the body is how we simplify it with patients. And we ask them, we say, hey, in the 3 to 6 months leading up to the onset of your tinnitus, when things got bad or when they started,
Yep.
was there significant disorder in your life or significant stress? So we approach it more from the was there psychological stress, a family issue? Did you lose your job?
Yep.
Did you just retire? Did you go through a health crisis where your body was putting your brain was putting more attention on different signals coming
Yep.
from your body? So we tend to see more of a correlation between life changes or body changes. There are some cases though where tinnitus comes up out of nowhere and the person says, I don't really feel stress. So I haven't linked that personally to like stress on the physical body or the system, but it's certainly possible.
So interesting. That's what I go back to sometimes because I think about, I grew up in Sarnia and if for anyone familiar with Sarnia, Ontario, that's Chemical Valley, right? So that's where all the Esso plants are and Bear and all, right? So Dow Chemical and all the places. And my dad worked in a lot of those places. So as I got more into minerals and heavy metals and what happens there, I can only imagine what his mineral pattern potentially looked like and the toxic load that it was on his body as well. So I always think back on that now, wishing I had that data.
Do you find that mostly affects the blood or the nerves or what exactly?
Can be all of it, right? There can be dysregulation from a blood perspective. Blood does want to be homeostatic, right? We're looking at something different in hair, if that's what you're measuring. But the reactions of the body going into that fight or flight response are real, right? And can be identified, especially with a heavy toxic load, right? Usually they start off in that fight or flight and it continues until it becomes so chronic that they end up going the other direction. But the body's still trying to keep that pace, which it just can't anymore.
Yeah, it's really fascinating. Certainly, in the last generation or two, we're just introducing a lot of new things into the environment, right?
Yeah, absolutely. Absolutely. Well, and let's talk about everyday habits that are damaging hearing, right? Even in younger generations, what do you find from that perspective? What does that look like?
Yeah, so preventing hearing loss, preventing tinnitus, the easiest to look at would be, hey, are you exposing yourself to a lot of loud noises? Most people aren't, frankly. I think there's certainly more use of headphones, AirPods, sounds in our ears. And yes, if you listen to that at a loud volume for most of your week, that could be exposing yourself to early hearing loss. But as long as you're keeping your sound levels modest and you don't have them in your ears 24/7, I think most people are okay. There are decibel level meters. So if you're wondering, is this sound too loud? Does that sound too loud? There are ways to measure this, and you can do a quick search to say, hey, at this loudness level, how many hours am I safe to listen to this per week? And there's published studies that say your chance of causing hearing loss are essentially zero if you stay within these limits. So people can use that as a resource. Certain groups have always exposed themselves to loud sounds. So in these times, people around music, loud machinery, certain jobs that are using equipment, loud equipment, shooting guns, gunfire, military personnel. These are all important areas to say, if you know someone in those fields, if they're not protecting their hearing, they probably will develop hearing loss earlier than they normally would. Instead of in their 60s, they probably will develop it in their early 50s. And it's preventable. So that's something that we can actually do on the proactive side of things. In terms of tinnitus, preventing hearing loss is usually the most logical path of potentially preventing tinnitus. Also, easier said than done. Keeping a healthy, grounded central nervous system. Don't push yourself too hard psychologically or through stress or through bad sleep. Yeah.
Yeah. Yeah. Well, and I find nowadays too, when you think about the stress that many people are under, sleep is one of the first things that they just get used to not having.
Totally.
And we know how dangerous that is because the body can't rest and repair.
And I
Yeah.
feel like I say that to a lot of patients, and I am inconsistent in my own personal life.
Mm, mm. We're all there. Right? We all have different days where you definitely sleep better than others. Let's talk about, so mentioned a little bit about AI, which is, AI is just so huge and it's only going to get bigger. Modern hearing aids. How has it affected it? What impact does it have? How has it affected patients? Give me some background on that.
AI has affected modern hearing aids in some cool ways. First, the most important function of a hearing aid is to
Mhm,
help the user hear more clearly. That's what AI can potentially help the most with.
mhm,
That's the key metric to get right with hearing aids, for example. So if someone has hearing loss, there's no cure to completely restore the cells that are lost, but we can help you hear better by using medical devices as hearing aids to
mhm,
correct the hearing loss. And AI can help separate the speech that we want to hear from the background noise that we don't care about. For someone with hearing loss, it's actually much harder to hear in a restaurant, not because they can't
mhm,
hear the sound, but because the tuning specificity of the cells inside of the cochlea, the hearing organ, those
mhm,
cells are not a discrete, sharp neurological signal. They've been sort of dulled due to the effects of hearing loss. So therefore,
mhm,
there's a spread of sound where ever go to a museum or a cafeteria and the reverberation just makes it really hard to follow along and hear people. That
yep,
happens almost inside of someone's ear, which makes it a lot more complicated to hear. So any marginal gains that AI can provide to speech understanding and background noise is changing lives. And it's available today. There are certain hearing aids that are leaning on the technology, more on the software side of things.
mm,
Additionally, there's AI that can identify an adult who's wearing hearing aids. Let's say they're an older adult and they're at a risk for falls. Well, the
mm,
healthcare system knows that preventing an older adult from falling or an elderly person from falling actually is really important for keeping them alive, for preventing significant hip injuries, potentially death. So their children can be notified immediately if there's a reported fall because the hearing aids themselves have the ability to detect
yeah,
changes from
that's
standing or
amazing.
laying down.
Yep,
So
yep,
that's a cool feature that can also potentially improve lives.
absolutely. That is a super cool feature. I didn't know that existed. I know my mother has, I got her a wearable that has that and it's got the fall, right? So it knows the impact and she did actually need it once. So yeah, some really neat things out there to be able to identify that. But I had no idea hearing aids would do that.
They certainly can. They certainly can. Your
Wow.
mom's wearing a biometric tracking. I love it. I'm not even wearing one yet. I feel like I'm behind the times then.
Yeah, she's embraced it for sure. Let's talk about TMJ. So posture, neck tension, and ear ringing. How are some of those interrelated? What are you seeing?
Definitely. So let's talk about the jaw. So TMJ
Mhm,
is the temporomandibular joint. So it's the joint that connects the temple bone to the jawbone or the mandible.
mhm,
And that joint can be really tight. The muscles in there can be constricted from stress, from teeth grinding,
mhm,
similar things. So there's a nerve that runs from the jaw to the brain. It's called the fifth cranial nerve, the trigeminal nerve. And there's another nerve that runs from the ear to the brain. It's called the eighth cranial nerve, and it's the cochlear vestibular nerve. So those two nerves can actually crosstalk or confuse the signal a bit. So if my jaw is hyperactive, where the nerve is like full, full on, it's really intense, then the signal can be picked up to some degree by the auditory nerve, and the individual will say, I hear a ringing in my ear. And as part of our assessment of patients with tinnitus, we have to ask, are there any issues with teeth grinding, jaw tightness, TMJ history? Because if they say yes, well, part of their tinnitus may be caused by the jaw. So that's an important part of the diagnostic process of ruling out certain conditions as part of a specific root cause evaluation, which is what we do at Tribal Health, as well as a cause-specific treatment. We're not just saying all tinnitus cases are treated equal. We're providing a specific treatment based on the various root causes at play. Similar thing happens with the neck, where there's certain cervical spine issues in the neck that can send signals up to the brain and crosstalk a bit with the auditory nerve regions.
Makes sense. Well, and it's interesting because, well, when people think about holistic health, right? It's what I think about, right? We're talking about taking care of our responses to stress. That's one. So journaling and things like that, our nutrition, right? But also taking care of our body. So whether that's getting a massage or maybe going to the chiropractor or being able to have time to relax and have a bedtime routine, right? To be able to allow the body to calm, right? You're talking about nervous system regulation. This is really important to be able to digress and allow that to not produce that stress response on an ongoing basis.
100%.
Yeah.
And I feel that, again, it's a subject that can be simple, but also is extremely complex. So even though I have a good sense of how to restore normal nervous system balance with my patients, the actual anatomy of it is rather intimidating, of how does it actually work with so many individual neurons in this complex system between the brain and the body, bottom up processing. Something happens in the nerves peripherally in the body, and then it changes the brain, or something changes in the thoughts or the brain, and then it affects the body. So I'm really fascinated by that. And I have a personal background in meditation and yoga.
Love it.
So all of that is so really interesting to me, the mind-body connection.
Yeah, so important too. And I find so many people, we're all kind of running around on fast forward a lot of the time, right? And that doesn't help the situation, to allow the body to again, kind of ground and be in that place of de-stress.
Yeah, with our tinnitus patients, we have a handful of techniques that work really well, because if the body's in a fight or flight response, it hears the sound of tinnitus in the head. Well, you can't fight it. It's in your own body, and you can't run from it because it's staying with you. So that really almost like short circuits the system in a really tragic way, where stress and anxiety cause more tinnitus. And unless we know how to reverse engineer this nervous system activity, it has a sort of downward spiral, which is really hard to snap out of. So with our patients, we're often using simple mindfulness techniques, as well as CBT, cognitive behavioral therapy techniques, to settle the mind, settle the nervous system, calm the body. Have a sleep protocol, CBT for insomnia, cognitive behavioral therapy for insomnia. An amazing protocol. It's been shown to be more effective than medication in most cases. And all of those things combined are what I believe has separated our approach, because we're getting into these things that, frankly, most hearing loss doctors don't even know about. But they, for tinnitus patients, they really drive the success stories. They get you from not just you can manage this to this is significantly lower and it's not a problem anymore. And then people will say things like, I'm so glad that I learned these things, because now I can handle stress and I can I'm more in tune with my body and my nervous system. So
Yeah.
in some ways, these are lifelong skills that they're having to learn because of their
Yep.
tinnitus.
Yep. No, makes sense. But lifelong skills that will give them their life back, which is why they're so important.
100%, 100%.
Yeah.
And they'll do anything. I mean, I have, 65-year-old military guys who
Yep.
say, you think meditation will help me? I'll try it.
Yeah.
So there's a lot of open-mindedness when, unfortunately, people are in such a difficult state, suffering. And yeah, it turns out that guided breathing techniques to settle the nervous system work really well. And people will say, wow, Dr. Ben, I wish I tried this earlier, or this is actually helping. I'm surprised. And that's the kind of
Yeah.
things we want with our patients of, try this thing that you haven't even considered. And because we've worked with thousands of people, we know this will probably work for you. And they try it and
Yeah.
they report back, okay, that helped me 20%. And we take 20% here, 30% there, 50% there, and then the person is significantly better. So that's how I approach it. That tinnitus specifically it needs a comprehensive treatment. Any one tool in isolation is not enough.
Yeah. Yeah. Makes sense. Talk to me about so you've got a YouTube channel with over 150,000 people, right? You built your clinic from that channel, right? You built Treble Health from that. Tell us about that journey
Yeah,
and how that played out.
the journey started when I was in San Francisco and I was in my
Mhm.
residency. I was seeing patients with tinnitus, and
Mhm.
I saw on my calendar that a patient was driving 4 hours to see me for an appointment. They lived in Lake Tahoe and I was in San Francisco.
Yeah.
And I thought, okay, I need to confirm with this patient. Are they really driving 4 hours? And they said, yeah. I went to my local physician. I went to my local GP. And then I went to an audiologist, ENT practice. None of them gave me any real solution. They said, here's your hearing test. There's not much you can do for tinnitus. It's not something life threatening. Maybe you have hearing loss. Um, that's it. So they found our clinic in San Francisco online and they drove for the appointment. They got a hotel for the night and the appointment went well. The patient left and I said, how was it? Was it worth coming down here from the
Yep.
mountains? And she said, yes, I'm so glad I came. This was great. I feel so much better. That appointment could have happened completely via telehealth. The technology was there at the time.
Yep.
This was
Yep.
2017. And that was an aha moment for me where I thought, okay, I really like helping patients with tinnitus. They're really suffering. I can make significant changes in someone's life and health.
Mhm.
And the technology tools are there to do this remotely. So that stuck with me and it took me a few years to gain the courage really to risk failing in front of my professional community.
Right.
But I was eager to try. So I started a YouTube channel and started making consistent videos.
Mhm.
Fast forward nearly 6 years later, and there's been about 35 million views on this YouTube channel, and
Wow, that's
you know,
amazing.
people from all over the world who say, "Wow, I'm so glad I found you guys. My local doctor didn't know this much about tinnitus, and now I feel
Yeah.
a lot better equipped." Along that journey, we offered. So I worked with my brother, who was an audiologist too. We run Treble Health together,
Mhm.
and he lives in New York, and I live in California. And
Mhm.
we essentially offered direct to patient treatment, and that's medical devices on the ears that are programmed for tinnitus and or hearing loss, as well as one-on-one doctor coaching and specific protocols to follow for more of that cognitive therapy side of tinnitus care.
Yeah.
Um, so earlier this year in 2025, we opened brick and mortar clinics in the United States. So we opened 2 clinics from zero, from the ground up, and then
Mhm.
we
Mhm.
we acquired or purchased 2 clinics from colleagues of ours who have been running their businesses for over 5 or 10 years. So yeah, that's what Treble Health is today. But really an amazing story, and
That is
the core
amazing.
thing is there is hope for tinnitus, and the more awareness we raise and the more cities we enter in terms of our clinics, then we're really just spreading the same message. There is something you can do. We can help you. Although there's no complete 100% cure, there are treatments that really work. So give us a shot and let
Yeah.
us show you what we can do.
Amazing. And tell me, so the brick and mortar clinics that you have now, where are they? Where are they located?
Yeah, they're in South Florida, so in Miami
Hmm.
area,
Hmm.
in San Francisco, California, Charlotte, North
Nice.
Carolina, and
Hmm.
Philadelphia, Pennsylvania.
That's amazing. Well, congratulations. That's awesome. I love hearing that. And you're still helping people. You still have people online. Yes,
Yes,
you can
so
still do remote
we
work.
see
Yeah,
patients
perfect.
globally, but mostly in the United States, some Canada, and
Yep.
we offer telehealth. So we've seen over
Amazing.
2,500 patients through a comprehensive treatment via telehealth. Our
Wow.
organization currently employs 12 doctors, so we're
Nice.
clearly filling a need.
Absolutely. Well, like I said, and it comes across my desk all the time because we mentor a lot of practitioners on minerals and things like that, and this is a common condition, to be honest, in a lot of cases.
And it
So I
falls
find
into
that
that
super
category
interesting
of,
too.
hey, how do we explain this? People might ask, is it heavy
Absolutely.
metals? I don't know. Why is this there? It's kind of confusing to most
Yeah.
doctors, right?
Yeah, I agree. Okay, so now I have to ask. So let's say, because you said earlier that hitting the 60s, right? That might be when a little bit of hearing loss occurs, right? As you get older. Uh, Somebody over 50. So I'm 52. I don't think I have hearing loss, but I feel like, we all think that. What do I do first if I feel like I have that happening? What do I do? Other
What
than call and book an appointment with you.
What's really cool is that if you have an iPhone, you can test your hearing for free. And it's a
Really?
hearing screening, but it will give you
Okay.
a sense of, good, bad, or ugly. What are we working
Yeah.
with? And
Yep.
if you have an abnormal result on that, then you should get a proper test. And
Hmm.
it's as simple as an eye exam. It's nothing
Yeah. Yeah.
complicated and
Yep.
easy to get. So you go into a
Hmm.
clinic and do an in-person hearing test.
Hmm.
From there, that'll be your baseline, and then you would go back every 2, 3 years uh, to get follow-up tests to measure the progress of your hearing or your hearing decline.
Yep.
I think for someone like you, that's the perfect thing to do. For someone who knows they have a hearing loss, then doing a risk-free trial of treatment is the recommendation there.
Yeah. Makes total sense. Well, and what's something that is there anything? Well, you kind of touched on this already, but we're talking about stress, right? So whether that's meditation or, managing stress in some way, is that one of the main things that somebody can kind of start with
For
as a
If someone
baseline?
has tinnitus, what
Yeah.
they can do right now is
Hmm.
play sound therapy at a soft level. So
Hmm.
that's specific soothing sounds, playing it at a level that's quieter than your tinnitus.
Hmm.
And simultaneously, you can either focus on your sleep or you can focus on calming your nervous system through anxiety or stress reduction. Those
Yeah.
things will help. Not
Mm.
every single person, but those things will help a vast majority of patients. And someone can start doing those right now.
Yeah.
There's more formal programs. There's doctors like us you can work with. There's medical devices on the sound based component. So
Hmm.
lots out there. And I definitely encourage
Love it.
people to put things into motion as soon as possible.
Yeah. Well, I agree because, again, I feel like there's so many people out there that just don't realize that there's something they can actually do.
That's right.
Yeah.
That's the main message.
Love it.
Going from,
I love it.
I was told there's nothing I can do to,
Hmm.
maybe I should try something and see for myself.
Yeah, absolutely. Absolutely. Well, Dr. Ben, you're doing amazing work for thousands of people. And I'm so happy that you were here to share with us.
Thanks, Lisa. It's great to be with you.
Yes, absolutely. So we'll have all of Dr. Ben's resources in the description so you can find him very easily. And For those of you watching on YouTube, thanks for tuning in. Make sure you subscribe to my channel. And for those listening on your favorite podcast host, we are happy that you're here. Give this episode a like, and I will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit LisaPitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Lisa Pitel-Killah.